Hello YouTube and welcome to another video. Covid19, the coronavirus, or whatever name you have for it, is spreading all over the world like wildfire. All hell breaks loose as the media gives the people more reason to panic, as well as ways to educate them about the virus. No doubt hysteria is in full motion, yet most are doing everything they can to secure themselves and their families. In this video, we're going to cover even more important details about this worldwide pandemic, what if you catch COVID-19, how to tell if you got it, and what are the appropriate actions that you should do if that is the case. Every little piece of information we're going to give you is of utmost importance, so please, sit down and give it a listen. First things first, gotta make sure it ain't the flu. In cases with moderate symptoms, coronavirus can be mistaken for influenza and vice versa. It is therefore understandable that those who have a fever these days ask themselves some questions. If you feel feverish, stay at home, minimize contact with other people, and evaluate the evolution of the situation. If you have any doubts at all, it is recommended at these times to report your condition. You can call your family doctor who can evaluate the situation and offer instructions on how to manage it. If you don't have a family doctor, there is still no need to panic. Just isolate yourself from other family members and if possible, still get yourself checked. If you are young, you have a better chance of getting through this successfully. Social distancing. If your city or country is not in a complete lockdown state, avoid using public transportation, ride-sharing, or taxis where you can be 3 to 6 feet away from another person. When outside, assume you do have the Rona and avoid getting everyone else involved in your own troubles. You wouldn't like it if you were just minding your own business, then the virus just drops by and invades you. So keep in mind that everyone else is probably thinking the same thing. In this state of worldwide pandemic, social distancing is the best policy. Separate yourself from other people both outside and at home. This is known as home isolation or self-isolation. Stay away from others as much as possible. You should stay in a specific sick room away from other people in your home. And if available, use a separate bathroom. Social distancing is not only for human-to-human contact. Everyone showing symptoms should limit contact with pets and animals. In fact, even without symptoms, limit your contact with your non-human companions, just like you would around other people. Yes, I know. Although it's rare for reports of pets or other animals becoming sick with coronavirus, it is still recommended that people with the virus limit contact until more information is known. Please, don't let the poor animals get sick too. If you must care for your pet or be around animals, wash your hands before and after you interact with them. Washing your hands often and thoroughly is the best way to prevent the spread of this deadly virus. Wear a face mask. If you're sick, it's pretty obvious that you should wear a face mask when you are around other people and before you enter a healthcare provider's office. This will prevent the spread of the virus to other medical staff near you. What if you're caring for others? What if the person who's sick can't wear a face mask? For example, it causes trouble in breathing. Then people who live in the same home should stay in a different room. That's the best you can do right now. Make do with what you're given. When caregivers enter the room of a sick person, they should wear a face mask. If someone in your home is sick, call the doctor's office or emergency department. Every state has now allocated emergency numbers exactly for situations like these. Call them and tell them you have or may have coronavirus. But don't ever panic. Hysteria will only worsen the situation. Cover your coughs and sneezes. This is pretty obvious, but you gotta cover your mouth and nose with a tissue when you cough or sneeze. Because if you cough in your hands, this is deadly. Your hands can touch your face, mouth, and eyes, and other surfaces too. Throw used tissues in a lined trash can every time you cough or sneeze. If you don't have a tissue, use your elbow. Immediately wash your hands with soap and water for at least 20 seconds. And that leads to our next one. You gotta wash them hands. Wash your hands often with soap and water for at least 20 seconds. This is especially important after blowing your nose, coughing, or sneezing. Also, do it before eating or preparing any kind of food. If soap and water are not available, use an alcohol-based hand sanitizer with at least 65% alcohol. Vodka doesn't work. Covering all surfaces of your hands and rubbing them together until you feel dry. Try to make sanitizer at home. Yeah, it's possible. Scientists say that soap and water are the best options, especially if your hands are visibly dirty. Avoid touching your eyes, nose, and mouth with unwashed hands, because these are entryways for the virus, and as we all know, it's all kinds of bad news once it gets inside. So from here on, we already know the general safety measures that we can do once we feel like we got the virus. The Ricardo Arona, no. The Corona Extra, no. The coronavirus is no joke, and you gotta follow these down to a T, since it will not only help you, but the people around you too. While we'd like to say that these are the only things to keep track of once you have symptoms, there's some more stuff in our part 2 that's more focused on what to do under the roof of your own home. Go check that out if you have the time, and with this whole lockdown shebang, I bet you have a lot of it. Anyways, don't forget to like, share, and subscribe to get more of our content. See you in the next video.